WHIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local.
Hello and welcome to our WHIS talk. I am very pleased to be here today. I'd like to welcome you all to our platform that is focused to improving health and well-being, sharing knowledge and creating an opportunity to better the world we live in. We do this through collaboration, specific pillars, through various projects. And we create a positive atmosphere that gives responsibility to businesses and communities alike to stimulate and facilitate change on local, national, and also international level. So this is a solution purpose with tangible options. Today, we are talking about health literacy. So what's health literacy? Well, health literacy helps people understand and engage in the management of their own health status. With the increase in health information available through media reports, through the internet, etc., many health information resources are easily distributed to a whole lot of people, to the general population. However, adequate use of these resources depends on individual skills in finding and applying those information. So that's not easy. The skills have been conceptualized as health literacy, and based on the World Health Organization definition, a model of health literacy has been proposed that includes the 3 levels and assumes both individuals and population benefit. We're looking now at functional health literacy, communicative health literacy, and most importantly, critical health literacy. So I'm very pleased to introduce the heavyweights of health literacy in the world, from Christine Sorensen to Andreas Dam to Anka to Katin and various parts of the world. Here we are, and like I said, welcome to WHIS for a very engaging and absolutely open to whoever wants to ask questions. Please put those questions on our social medias. Will be replied to those questions live. So let's start with Christina. Thank you and welcome. Would you like to introduce yourself just briefly, and then perhaps Andreas and others can follow through?
Yeah, thank you, Manuela. My name is Christine Sorensen. I'm based in Denmark. I'm the president of the International Health Literacy Association and also the founder of the Global Health Literacy Academy. And I work in terms of consultancy and education for improving health literacy around the world.
Wonderful.
Hello.
Well, you do a lot more than that, but certainly it is a start. Andreas, what can you tell us about you?
Thank you. Well, yeah, my name is Andreas Dam. I'm the CEO and founder of Daman, and we are working with improving people's quality of life through the use of digital healthcare services. So I spent the last 19 years working in digital and healthcare. And particularly since 2013, I've worked with patient empowerment services within the field of digital health. So I'm really glad to be on this talk and happy to share all our experiences and challenges and learnings along the way.
Yeah, wonderful. Yes, terrific. Very pleased to have you. Thank you for your availability. Katina, very good early morning to where you are here in United States. So please introduce yourself. Katina, you are muted. Muted? Yeah, okay.
Look at how I'm following instructions. Mute myself when I'm not talking, and I've got to remember that.
Well, there you go. It's early morning.
You got it. I'm Katina O'Leary. I'm the president and CEO at Health Literacy Media. We're a health literacy nonprofit in the U.S. I sit in St. Louis, Missouri, but we work around the world. And our job is to help people understand their health literacy. So we work with companies to help them communicate more clearly and better with the people that they serve.
Oh, wonderful. And Anka Sabu, you are in Switzerland, so good morning to you. Tell us a little bit more about you.
That's right. Thank you, Manuela. I'm Anka. I'm the founder of the Digital Aid Project. I'm based in Switzerland, in Zurich, as you just mentioned. I'm basically a public health specialist and healthcare innovator. I'm affiliated with several organizations, but my last, I would say, big initiative was the Digital Aid Project, which started in the first wave of the coronavirus, and we managed to bring together more than 80 volunteers working pro bono on helping long-term care facilities continue the provision of care in times of crisis.
Oh, great. Fantastic. Okay. Well, so much to ask, so much to know from all of you. Fabulous, great experts. I'd like to start with Christina, and then there's no really, anybody please jump in and make comments. But look, I just got to the chase. How important is health literacy, or a good level of health literacy, in this COVID-19 era, which certainly is changing everybody's lives? How important is it to have good health information? How can we go about this? How can we improve that? I'm not quite sure we all have a good level of health literacy. What's your comment, Christina?
Yeah, I think our self-image is that we have a pretty good level of health literacy, at least in the welfare countries, but some research we made years ago showed that unfortunately also in welfare societies we have a challenge related to limited health literacy. European research showed that more than 1/3 of the populations face difficulties in finding and understanding and judging and using information to take decisions regarding their health in everyday life. And in some countries, it was even 2/3, so almost 70%. And that was a shock to our decision makers at EU level, because they thought we have good healthcare systems, good educational systems, and still we lose a lot of people on the journey. And especially also considering the digital divide, that some people have easy access to digital resources where others are still struggling. So we do have to face a triple burden that there are people in our societies that are poor, and there are people who have poor health, but then also poor health literacy. So we are trying to focus to bridge this gap, and this is why I'm so happy to be with our colleagues today in this panel, because I know they are really dedicated to finding solutions on working with people, not for them. And they are really contributing to the social transformation that we see in these years, and especially now with COVID-19, where these gaps became really apparent also for our decision makers.
Right, that's right. And so could we say that, I don't know, I'm being the devil's advocate here, but should we say that health literacy, it's more, more prominent, more known, better embraced in Europe versus, say, for example, United States? And I just, sorry, I just want to put a little focus here. spot on American, Katina. So what can you tell us? I mean, we're all watch the news. We all have this thread that companies all every day. What's happening over there? And so tell us. We're interested.
I think you're really right. I think that there's a variety of perspectives on health literacy, and there's a lot of government level action in Europe and a lot of government level discussion about health literacy and health that's a little bit different than we see here in the US. And I was thinking as Christine was talking about COVID-19 and just the difference in how people experience that. There's an article that came out this week that the bulk of the misinformation about COVID-19 actually was led by the highest levels of government here at the US. And when you think about the reality that people are trying to struggle to find information to begin, and then the information they find in their most trusted sources may not be accurate, that there's misinformation and even disinformation, which means purposeful incorrect information, it's hard to imagine how regular people sort of navigate and figure out what's true and how to make action. So we're really struggling with that. It's a struggle to think about how we align information that's accurate and we get that out to all the people who need it, particularly in a very political time. So we're a month out from a major election. There's a lot of discussion about leadership and how people would lead and what their choices are. So for us as health literacy leaders, as nonprofit leaders, I think we have a particular challenge to think about how and what we communicate and how we talk directly to people about their own health. It's very different here.
Right. And so in that, and thank you. Yes, I can understand. I really see your point. Andreas, you are an expert in e-literacy, and you have a wonderful knowledge in that. So how can we then how can we really build this health literacy in a digital form where we know very well that that could be okay in some countries, but if we're looking globally, it's not that everybody has the ability, the resources. What about the actually built-in knowledge, even to understand? I mean, I know a lot of people who still here in Australia don't have access to internet, either by choice or by location. So this is a struggle. So what kind of options do we have?
Yeah. So I think at least what we see in many of the Western world countries, it's actually there's a high growth rate in terms of internet access and so on. And even in, let's say, poorer countries, there's also a high penetration of smartphone usage. So actually, we see that technology is pretty well existing, at least in many areas of the world. But I think one important aspect is that designing for people, for instance, when they are under special circumstances in their lives, like threatened by a really severe disease or something like that, we really have to consider how we design services there, because they won't have the same cognitive capability, they won't have the same energy to drive certain behavior and so on. So our experience is that using co-creation, which is a methodology for, it's a user-driven innovation method, where you really bring patients, relatives, and healthcare professionals together in a design process with those providers of technology. So I think, and there is still a challenge there, because some of those people we really want to design for, they can even be hard to identify and recruit for these co-creation processes. But at least we can get really, really far by putting these people in this, by applying a design methodology and putting these people together. Because I think also what we see in a number of markets is that the healthcare ecosystem is sort of driven from an inside-out perspective. So a lot of the processes and the way we organize the delivery of healthcare is designed to fit well with employees in our healthcare system, but it's not really designed to fit well with people living or coping with a certain disease.
Right. Yes, absolutely. That's a very good point. So now coming to you, Anka, and welcome. So how then? How do we then fill the gap? I mean, I guess what Andreas suggested, is that what we can ask people, we can ask communities, really, what do they want? What do they need? What kind of gap? What do we actually even understand? What's the need there? So what type of tools can we use to improve health literacy?
Right. So what we were trying to do actually with the Digital Aid project, and proved out to be quite a big success in the first wave of the COVID, it was actually to bridge the gap between the patients and the healthcare professionals in long-term care facilities, as well as digital innovation in healthcare. As a healthcare professional myself, I work in the hospital management here in Switzerland. I have seen the gaps. I have lived these gaps, not only in the COVID period, but also beyond that. And I was always wondering why there's not the gap. It's always the same, right, in long-term care, whereas in university hospitals you see a much more higher acceleration, and this has a really direct impact on health literacy as well. In Switzerland, being a private healthcare system, maybe Katina can relate with what I'm talking right now, you can see that actually people are more tempted to go either to a fully private hospital if they have the chance, or to gather around with their healthcare insurance, rather towards the university hospitals, whereas the regional hospitals do not have such a big credibility. And the gap that we were trying to fill actually in two of our objectives with the Digital Aid project was actually to avoid the patient distress and to minimize the stress level of the staff in times of public health crisis. And in both these categories, or in both these objectives, we gathered an extensive list of digital solutions that are actually tackling this problem, or might be able to help the patient or the healthcare professionals in this aspect. Many of these innovations were actually coming from the digital spectrum, of course, and many of them were actually touching the health literacy problem. Because in times of COVID, what we experienced in long-term care facilities, and when I say long-term care facilities, maybe it's important to mention that we are here referring to nursing homes, but as well mental health facilities and rehabilitation centers, where the average length of stay is around 1.5 months. So here the patients did not understand what was going on. They were not aware of what is crisis management, because you're a patient in a hospital and you just know what is important for you in that moment. But the whole hospital organizational structure is changing in times of crisis, from strategic management, let's put it this way, to crisis management. And all of these factors are actually affecting directly the patient. So what we were trying to do, it was gathering a very extensive list of digital solutions able to make the patients cope better with these changes, make them understand what is actually going on, make them empowered to be able to contribute to their own safety in the hospitals, rather than being distressed because of the external factors. In the same way, it was the exact same situation for the healthcare professionals in long-term care facilities. And as I said, I experienced that myself. I work as a quality manager and organizational development lead in the mental health hospital. And the problem we were actually facing, and I know from my colleagues in other hospitals in the same function, it was actually the knowledge about how to use the PPE, about how to react in crisis. Because in long-term care, the knowledge is not the same. And when we talk about nurses, for example, and we say, hey, we need to empower the nurses in general, then you might just think also about that, because the knowledge that the nurse has in a psychiatric facility or in a nursing home is not the same with the one in the emergency room. And that was exactly what we needed. So we actually needed to train our professionals really fast, let's just say yesterday, about how to use the PPE, how to actually implement clinical risk management very fast. So
excellent. Yeah, and so you were able to do that. Your organization, were you able? Did you see tangible changes once these interventions were carried out? That you were.
Right. So what we were doing actually at hospital level, it was exactly going towards the digital innovations, because there are so many tools out there that we just need to know how to identify and how to harvest in order to bring them closer to the patients, but nonetheless to the healthcare professionals. In my opinion, as a public health specialist, but also, as I told you, as a frontline worker, I think it's critical that we emphasize first the health literacy of the health professionals in order to be able to achieve the health literacy of the patients. I have experience in many healthcare systems in Europe, and I don't know, maybe for you, Katina, or for Manuela, it's just like you might just think, well, it's Europe, right? We have more or less the same level. The differences are really huge from one healthcare system to another, and you can just barely compare. Let's just say Switzerland and Germany. We have lots of differences as well, right, Andreas? And when you just go from Spain to Romania, where I also have experience in both, you might just think, well, there's a lot of work to be done. And when we think about health literacy in terms of the patient, the approach might need to be at total different levels. But the health literacy of the health professionals, I think it's critical in order to achieve the second.
Okay, yeah, well, excellent point. That now I'm going to ask Christina. Well, so that's fair. Yes, we need to obviously improve the health literacy and preparation and background for long-term care, as well as for mature care, for acute care, for healthcare professionals, certainly. But what about the lay person? What about the person that is at home or in quarantine or in kind of half and half, maybe, and thinking, well, how can the trust, what's the meaning of trust into health literacy? So if we think about that and what people gather from either social media or from the news or from whatever information they can gather, talking about Australia, from the Australian landscape, there is variable trust, put it this way, and people who may or follow through what the leaders or government suggest, then some kind of jumps, from one way to another, because they kind of sort of somewhat get their knowledge to fit in something that they prefer to choose. So how trust fits in? I mean, all of a sudden we need to trust a government.
Yeah. Andreas asked, let Andreas answer.
Tell me.
Yeah. So I think this about trust is very interesting, because there are some, let's say, bigger macro trends changing a lot in the world that also impacts the way we perceive healthcare and our governments and so on. And what we have seen in most industries is this drive of consumerization, in the sense that we as single human beings are no longer so just listening to our authorities. We also become experts ourselves and so on. And I think here health literacy is really, really key, that again, we do this jointly with those that are really, let's say, medicine experts or healthcare professionals, together with people living with certain diseases. So I think that this trust thing is changing right now. I think, for instance, we are working with a principle called crowd caring, and that means really the trust of each individual person living with a certain disease is one of the things that we use the technology to empathize and bring together. Because I think a lot of people nowadays, they don't trust single authorities anymore. They don't trust their doctor. They don't trust their president and so on. And I think it's, we're never gonna go there again. So I think more we should really see these new opportunities, but do this in a good way. And again, I mean, to us, patients are experts in living a life with a chronic disease, but if you take a doctor, he is expert in medicine and treatment and so on. So those two roles are really key going together. And that's also, we are taking part in a number of shared decision-making projects. And that's also where we really see the future, that it's no longer the doctor who is just kind of the king and decides everything. It's a shared effort. And this is also in the light of more and more people living with chronic, or let's say less acute. That's also what you describe, Anka, that you have patients for longer durations. And And a lot of cases, actually, people, they are at home. They are, I mean, a number of the chronic segments we are working with, they are maybe seeing the hospital 15 minutes 4 times a year. That's 1 hour, and all the rest of the time they are on their own. And there we really have an opportunity, but also an obligation to support and enable them well in their daily life.
Christina, your comments on that, I'm interested. I read something you wrote that health literacy is political, is it?
Yes, I keep emphasizing that health literacy is a political choice. And I even wrote a piece called Health Twitteracy, highlighting also the role of politicians in decision making. And I think the healthcare system has been its own big enemy because we have been so slow within the system to take up new innovations. Steve Jobs said that everything older than 5 years, that's vintage. And another research showed that in the healthcare system, it takes up to 17 years to adopt new practices. So we were faced with a really slow uptake of new innovations, and we have to find a way how to actually speed it up, because I think people, they have already taken in these new technologies, but if the system hasn't, then we are the ones slowing new developments down. But perhaps, Katina, you can allude to that as well.
Absolutely. Katina, what's your thoughts?
I agree with everything you said. I think that there's a real challenge here. And, another challenge is even just convincing people that they need to be thoughtful about the media that they use. I gave a talk earlier this week where over half the time of the discussion was trying to make the case for somebody that health literacy was its own special construct, and it's not just literacy. A lot of people are really comfortable and happy with the idea that health literacy is just for you, and it's just a problem for certain people who are lower income or lower educated for sort of the other, when the reality is this is hard for all of us all the time. We're all struggling. The information is particularly challenging right now. It's fast-paced, ever-changing, and the amount of misinformation is really bigger than ever before. And I think, to your point, Andreas, I think it's great that people are experts in their own lives. I believe that. I'm a social worker by training, so that's in my sort of blood. That's the way that I think about the world. But there's also the truth that when there's new information, what you think you know is not always correct. What you think you see is not always accurate. What you think you feel, what you think you've heard from your best friend's brother's dog, whatever on Facebook or Twitter or wherever isn't the kind of information that we need to sort of move forward. So figuring out how to help people identify appropriate sources that are factual and accurate and help them sort of carry forward information that's usable for other people, I think is one of the biggest challenges we face in healthcare right now.
Absolutely great, Katina. Thank you, Anka. Just a comment as well on the matter of trust in long-term care. How do you? What's your view on this?
I wanted to add on actually what Andrea said earlier about a matter of trust in the people who are actually at home and they do not receive the information they might need in order to be able to protect themselves. And now getting back to the times of crisis, I would like to mention that this has definitely also financial implication for the healthcare systems as a whole. So the lack of health literacy actually hurts our pockets, to put it this way. And actually making a parallel to now what Christine said, it's definitely then it should be a top-down implementation happening soon, so from the policy level. But I think there's still a lack of understanding also on a policy side, because otherwise they would just move quicker when they would realize how much money is lost because of the lack of health literacy. And now a very easy example in times of crisis. So let's just take the COVID crisis in hospitals all over Switzerland, in long-term care. And again, here we're talking, now actually mostly about the mental health facilities and rehabilitation centers. The patients had the option to opt out, so to get an early discharge regardless of the DRGs involved. That's like just the financing system. So in that sense, the hospitals lost quite a lot. and nobody looked at these numbers. I think, I'm not sure if they are looking at them now or they are still busy preparing for the second wave, but there's going to be repercussions, of course. And the early discharge in this case, in my opinion, it was due to the lack of understanding and the lack of trust in the healthcare facilities and in the things that were going on. All of these things could have been solved with a higher level of health literacy, in my opinion.
Right, and that's very true. However, it is also true that healthcare, whether it is hospitals or primary healthcare practitioners, really don't have the time, the equipment, the knowledge, the training, and so people are basically left on their own, and that whereby the sort of ongoing self-management of some sort start, and therefore misinformation perhaps and lack of trust, etc. So Christina, I mean, I can absolutely say that health literacy is the underlying factor on most SDGs. Really, if you look at all of them, you could say, well, probably health literacy here can fit in quite well. So it is really the backbone for the Sustainable Development Goals. No matter how you look at them, and you can tweak it to planetary health or to healthcare, etc. So intangible method. I mean, really, what do we need? Do we need to have specific selected personnel, for example, in hospital, whereby patients have to have, like, let's say, a pit stop, need to sit down and need to talk about and receiving instructions in a way that is cooperative, in a sense, for self-management once they go home? Would that be a good start?
Mm-hmm. In terms of changing the environments to be much more health literacy responsive, I think we have to look at five levels, really from the very small details on how we design our communication material, from pictograms to text, but also how we interact, what kind of products, like we've heard our digital products here from our colleagues, and to organizations. So you can look at health literate organizations and even health literate cultures and societies. So it goes from the very detail of the pictogram to a large way of a paradigm shift in our culture, where we change from a disease-oriented focus to a health-oriented focus, from a burden perspective to an asset perspective, and a new way of let's call it whole of health, where we make systematic approach to protection, to care, to prevention, to promotion, where now we are trying to fix everything. Instead, we should try to have to build up our resources and our health capacity in a way where we focus much more on being healthy from the beginning. And then, yes, life happens to us and we become ill. But at the moment, we put much too much resources on trying to fix people's problems where we could have prevented most of it. And we know that 20% of budgets right now are lost due to the mismatch of matching people's health literacy. So investing in both people's personal skills would be good, but also we need to look at the way we design our organizations and the resources and the products, and eventually shaping a new culture. So it's a big ambition, but I think we have to do it. We're forced to do it.
It certainly is, also because for non-communicable diseases, really, whereby acute care really doesn't apply, primary health care also does not apply, and in some countries like United States, where there's no even universal health care, really improving health literacy equals to improving.
And I think, Manuela, we have to look at health as a not only physical health and mental health, but also social health, which became apparent during this pandemic, and also spiritual health and sexual health and emotional health. Health is so much more than just trying to prevent communicable diseases or non-communicable diseases. It's really about having the ability to live flourishing lives and have a good quality of life under the conditions you have. And how can we do that? That's what my colleagues here are really good at, in trying to match those challenges.
Right. So, Katina, just asking you from, once again, the American perspective in regards to what we just discussed, how can you teach people how to be well, how to stay well, how to wanting to stay well? Is it part of perhaps really taking responsibilities on and making the right options, understanding though that, of course, there are financial issues and the obstacles are huge, of course, to be a well nation. You have to have an adequate healthcare system. But how? What's your comment on that? I'm interested.
Well, I think Christine really did a really nice job of thinking about sort of levels of health literacy and how this fits. And, you know, we've throughout this conversation really, unfortunately, been thinking about health literacy as a trait rather than a state. And this idea that, you know, if you just deliver enough education or enough information, people will learn to be smarter and think about it differently. And that's not really what I found the way it works. We don't change sort of this basic foundational information and education enough to make people capable of handling these very complex systems. So the U.S. is a great example. You know, across the world, people think of us typically as very resourced and able to handle many of these things, but our healthcare system is a nightmare. So there are multiple levels of our system. We have certainly the public health insurance, or the public health insurance, private health insurance, and a public health system that lays on top of that. All three systems are in disagreement. So for any person to understand those things is a particular challenge. But when your participation in the system changes because you lose a job and your insurance changes or your activities change, you have to think about a whole new system and a whole new thing, a way that things work. The financial implications that Anka suggested earlier are really prevalent here. So, you know, I think it's more than just how do we teach people to prevent. I think we have to think culturally about how do we change the way we have discussions about health and wellness. How do we think in communities about how we come together? What do we do when we teach kids in school about their bodies and health? What's going on with science communication? One of the classic issues with COVID here is people talk about, well, you know, the rules aren't clear. You know, last week they said don't wear masks, and this week they're saying that masks are important. And the reality is that nobody ever said don't wear masks. What people said were masks were not a certain tool to protect you from getting COVID all the time. You need to take other precautions. You need to social distance. You need to stay at home. You need to wash your hands. You need to think about what you personally need to do, not what you want to do. And you have to be responsible to each other and think about what's safe for the whole community. And that's a much more challenging task that infringes upon your personal ideals of what you want to happen today. But in America and many other places around the world, we're not good at that. We want to do what we want to do. We don't want to think about how it impacts everybody else all the time. And there are consequences to that. So how do we change the culture to make people think about each other, to think about the implications of their activities on everybody else, and to make good choices in the context of changing information that's changing appropriately because we're learning more based on science? How do we do that when people don't always have the foundations? I think those are also the real questions that we're struggling with.
Right, and it's absolutely, what a great point. So, Andreas and also Anka, perhaps you can please comment on literacy. How early should we start with health literacy, maybe on illiteracy, that is? Should we start in primary school? How early can we go? How soon can we start with this? Because clearly, and look, I just want to just to perhaps share briefly, because we're running out of time, an experience. There've been some amazing programs in Thailand, which have been participating to, and where younger kids, right, were actually being taught that perhaps uncooked fish could lead to severe disease. And this is a common thing, right, that happens in Thailand. And so these little children were then teaching their grandfathers and grandmothers to say, well, maybe you shouldn't do that because you end up with, some issues, some health issues, significant health issues. You can even die out of that. So that type of communication was just the reverse, right? So young children teaching older parents. Do you think that's a good thing to do, Andreas?
Well, I think this is it's a very interesting topic, how we drive this with the cultural and educational side of things and so on. To be honest, my focus is much more when So to give you one example from my own life, this April, my father got diagnosed with bone marrow cancer, and the specific disease is called amyloidosis. Well, before that, I had good knowledge around the field of oncology, cancer, and also because I worked with this. But it's only at the point in time when that kind of thing hit us that I was really motivated to learn around this disease and how my father should behave, how we should behave. And he's now in a risk group also with COVID and any other kind of infection he could have and so on. So for me, I just think we can have this vision to bring it to anybody's attention and be a root or a foundation. But I think, at least based on my experience, it's very difficult to drive. So I much more believe when we are stepping into something, we need to onboard people quickly and in the right way. And here I think digital technologies and another thing is, so we're getting more and more well-educated in general and also more digital savvy and so on. But the acceleration of advanced therapies, medicine, precision medicine, AI is also very, very fast within healthcare. So that's also why we really, when we're entering these complex situations with secondary, tertiary care, I think there we should focus a lot because that is really, really, really life-saving with the impact we can do. And of course, we can also do a lot in prevention. I'm just, I don't know what would happen with that kind of fish thing if that turned out differently, because still our healthcare system will catch a lot of things that we can still remediate and so on in the primary.
But just to add to this, I really agree with what you're saying. You need the information when you need it. So when you think about cancers, heart disease, these really, sudden onset, you need to know then. And there's no reason for you to have all that information necessarily before. But you have to have the foundational information to understand how to make good sense of information, how to know where to look, how to know what's valid. And I think a lot of us are really falling short in teaching younger people the basics of science and math so they can even understand risk. So I'll give an example of my own friend. I have a friend who's a lawyer. She's very well established. She's very well read. She's very literate. She has a breast cancer diagnosis. So she goes in, she's finished chemo. She goes in to get her surgical appointment. She's expecting to get a lumpectomy. And at the moment she's about to tell them what to do, the doctor introduces information that there's a higher risk of recurrence in a lumpectomy than mastectomy for women her age. And the bottom fell out because that change in risk by 15% changed everything that she needed to think about for the rest of her life. And so she had to cancel the appointment, come back days later with new information and all the things that had to happen based on the fact that she wasn't prepared to hear that information. She wasn't prepared to interpret the science to make the decision. And it was overwhelming, right? So it's, again, educated person, talented, all of these things, point in time information is good, but we also have to have this background and foundation to make sense of risk, to evaluate, to balance those pieces of information. And so it's really complicated. And so I challenge us to think beyond one solution. This is multi-level. And we really have to be serious about that from the earliest times in school. We have to be really serious about science and communication and art and communities and all of these pieces that form whole people who make good decisions about their health, which it sounds like you're doing with your dad as well. So I don't want to put that down, but I want to make sure that we don't step away.
I completely agree. And I think in particular with the what social media and influencer marketing and this storytelling is such strong voices, and they really challenge our evidence-based scientific approach. So I definitely agree that I think on the communication side of things, I think one good example is actually here in Denmark. We had a lot of, or actually few stories, but the result was that nobody was getting vaccines anymore. And it basically what the Danish healthcare authorities now did, they are present on social media. So they've learned that they are communicating in this old scientific way, but they forget that we as humans, how is it that we learn? Well, when we sat at campfire a long way back, we learned from storytelling. So the way we communicate in general, I think is so important. Right. I would still say, I don't think we can prepare people for, if I got the message tomorrow Andreas, you got cancer, you got 10 more months to live. I could be educated so much, I could not prepare for that message. I would need a design from the message tomorrow that I had enough time to speak with my wife, think about what about my kids, what my parents, and then come back maybe to make a shared decision on what would be the right treatment for me, if there is any options to do there. So I think, again, we need to design our treatment journeys or our patient journeys better. And I don't think we can prepare for these life-threatening events that will come. Because if we're trying to prepare for that, we would be alert mode all the time, thinking, shit, maybe tomorrow I'm gonna pass away. So yeah, just a perspective from my...
Yeah, I think we have to change again or realize that from a professional side, health is very much about communicable disease, non-communicable disease, prevention care, AI, and so forth. But when you ask every one of us in daily life what is health, then it's about being able to go to work, earn some money, have a good time with my friends and my family, go to the forest for rest. You know, health is something completely different. And this, what you're saying, Andreas, is that the story that we tell from professional point of view doesn't match the layperson, and we don't speak the same language. So we have to find a way to translate those messages that will actually enhance the lay people's quality of life to actually be able to go to work and spend time with your family and friends. How do we do that in the best way?
Well, I think, and this is, I'm sorry, we just now really at the final thoughts, but before I ask Anka just to give us her final view, it's really, truly, health literacy is empowerment. Health literacy is supportive, that empowerment, and to be able for people to make informed decisions in a way that it is not fear-based. And I think for all of us who have been working or still work in healthcare, as healthcare practitioners, absolutely understand that. Anka, please, just again, your thoughts in what's the future here, I mean, in long-term healthcare, what's innovations, what you're looking for, what do we need?
I'm just hoping that the future of health literacy is going to be about building the chain of trust. What got me really angry in the last month, it was this people were trusting more Google than the World Health Organization. And I think this situation is happening for years. So I'm really hoping that our decision makers, and when I say ours, I mean healthcare decision makers, are going to able to tackle this massive wave that is coming towards us. So then I think in the sequence of the chain of trust, we are going to be able to be our own masters, to become ourselves empowered patients, because in the end, and I like this phrase because I think people do not hear it enough, regardless if they work as in politics or in as a decision makers or as a doctor, we are all patients. So I think it's in the end all about that. And in health literacy, I think that is the key. As far as we know that we are also patients, myself, it doesn't matter to me that I work now in a hospital. I can be a patient one day in the same hospital, right? So I can pass all the information that I have forward, as Andreas gave the very good example with his father. And when the situation comes, we can literate the ones who are less literate than us. And I think that's also part of building the chain of trust in health literacy. The purpose of everything must be where the stream is coming from. So I think that's the big question. Where are we looking for the right information? And when that thing is perfectly embedded or implemented in a healthcare system, I think we might have a big chance to succeed.
That's right. Thank you. That's wonderful. So empowering everyone all the way, making information available, clear communication, rebuilding trust, and really self-management as the non-communicable diseases really very much so require engagement of the patient and larger communities. So very, very much closing statement from Christina and then Katina and Andreas, just to conclude today's talk. Christina, what's your future? What's your thoughts for the future? What's your hope?
I think the future is that the movement of health literacy will continue to rise. At this stage, it's very much driven by professionals working from within the system, and I think that that's the comment from Andreas earlier on, that the health systems has been designed very much inside out, and I think the change also has to come from there, so that we can help people really know about their rights and obligations. And we cannot, I think, tackle the burden of the pandemic, the burden of NCDs, if we cannot unite our forces at individual level and political level, societal levels. We have to have a changed view on what is health and how do we protect ourselves, how do we prevent risks, and how do we stay healthy. And then also lastly, how do we learn and de-learn and relearn, because the world will keep getting more and more complex. So we have to get used to managing these new trends in a very flexible way. So that's my hope for the future.
Thank you. Thank you. Katina, last comment?
I couldn't agree with you more. And I think that I would just add that we really have to be focused on health being more than sick care. So I appreciate the comment that we can be patients at any moment, but even when we are patients, we're still people. We're human beings who happen to need help at a particular time, and we need a system to help us. And we need to be able to understand that with our family and the people that are trusted sources around us. But all the time we're people, we're always in communities, and we need to work together toward our collective health to make us all a stronger world. So I appreciate the time to speak this morning.
Thank you. You're welcome. And Andreas, your last words.
Yeah, I would also say I'm actually more optimistic these days than I was some years back, because I do see acceleration. I see an acceleration in terms of the way we partner up, the way we collaborate. So we also believe that that small organizations, scale-ups like the one I represent, should work together with healthcare politicians, but also with the more at clinic level personnel and with other industry partners and so on. So I'm positive around that. And I'm also positive around the traction we see among people with lower health literacy, because actually those that are already really empowered, we don't want to help them much because they will manage just fine. But we see now that we are getting better traction among the more, how to say, social challenged or those segments that really need help. So I'm positive in general around that.
Wonderful. Great. So I would like to conclude this session, and thank you very much to all of you for your time, availability, presence, words of wisdom. There's a lot more to talk about. October is a health literacy month, so let's look out for these wonderful trailblazers in the field of public health. Health literacy, once again, remains a very, very, very important. I can't underline how important it is. It applies to all SDGs, in my view. And so improvement of health literacy can only improve healthcare globally, and as well as at community levels. So thank you again. Good morning and good evening.
Thank you.
Welcome.